Good morning, everyone. Welcome back to the UBC Learning Circle, hosted by the Center for Excellence in Indigenous Health. We are very excited today to welcome physiotherapist Matthias Muller and Dr. Virji-Babul into the circle today to chat with us about the effects of sport concussion on the developing brain. So before we begin, I would like to acknowledge that I'm zooming in from the traditional, ancestral, and unceded territories of the Hunkaminam-speaking Musqueam people. I would also like to acknowledge the First Nations Health Authority for generously funding the UBC Learning Circle. So for today, the topics we cover can often be sensitive or emotionally triggering. If that's you for today, please make sure that you're looking after yourself. If at any point you feel that you need to talk to a friend, elder, counselor, family member, whatever that support network looks like for you, please don't hesitate to do so. So on to introductions. In case you didn't know, my name is Cole. I'm from the Chowethel First Nation. I'll be facilitating the discussion today. Other Learning Circle team members in the room, but off camera in the room, are Cynthia, our production coordinator, and Winona, our assistant coordinator. If you feel so inclined, please introduce yourselves in the chat box as well. There's been a prompt for that, and we'll look forward to all kind of coming together and learning in this space today. So without further ado, I think I got through that in record time. I'm going to pass the mic over to our guests to introduce themselves.
Hello, everyone. My name is Matthias Muller, and as Cole mentioned, I'm a physiotherapist, and I'll be presenting first regarding this topic.
Good morning, everyone. My name is Virji-Babul. I'm also a physiotherapist and a neuroscientist and an associate professor in the Department of Physical Therapy at UBC. Looking forward to the session today.
All right, so I'm going to start off, everyone. So again, my name is Matthias Muller, and today we'll be talking about the effects of sport concussion on the developing brain. I'd like to initially start by acknowledging that I live on the traditional and ancestral territory of the Lheidli in Prince George. So a little bit more about who I am. So I mentioned that I'm a physiotherapist, and I work at Physio North Sports and Wellness Center in, of course, Prince George, BC. And so a little bit more about my concussion history. Right out of school, when I graduated physiotherapy school, I began wanting to specialize in concussion. So basically, I looked at the best courses to be taking, and I found out through the Complete Concussion Management Program, taking that as a clinician gives you the best tools, I felt, to help people that I saw deal with concussion. And so my background for knowledge is mostly through complete concussion management as a clinician. And then as well, because of that, it's facilitated some incredible experiences that I've had over the last 3-4 years on talking with people and having them share their experiences with me in the clinic regarding their concussion. And I get the amazing experience too of getting to see people progress through recovery of concussion. And so the whole idea about presenting today for me is to give a little bit more insight to other folks that may have had a concussion or have not had a concussion about some of the things that come up regularly that I see from my experiences as a clinician, and hopefully answer some questions you might have as well. I can't stop showing photos of this little dog. Her name is Juniper. I got her this summer, so she's been one of the best things about 2020 for me so far. So I have a few more photos of her in this presentation. So we're going to move ahead. So the main overview of this presentation, my goal is to, like I said, cover some of the topics that are very commonly covered and asked in clinic that I see people for concussion with. And so we'll start off with some myths and misconceptions of concussion, and then talk about, of course, what is the definition of it, talk about why it's so common and what the prevalence is like, especially in sport, how to identify a concussion, our current understanding clinically in Western medicine of how to deal with concussion, something called Post Concussion Syndrome, which is actually quite common. I see a lot of people in the clinic for it. And so because of it, I want to bring it up. Baseline testing is important, especially with athletes. And then again, at the very end, just some further information and some ways to provide more education if you'd like it following this presentation, where to go, that kind of thing. And I'll finally say too, with my presentation, we've geared it a little bit more towards athletes and sport and youth. And so because of it, a lot of my slide presentations will say that. That being said, just so you all know, I actually probably see more people for concussion in the clinic that have had a fall. It's moving into the fall, winter here on ice, that kind of thing, and hitting their head or other parts of their body and having a concussion, or from vehicle accidents. So it's not just sport or athletes that get concussions. It's a wide range of people, wide range of age and other demographics. So myths and misconceptions of concussion. Myth: an athlete who loses consciousness will have a longer recovery. It's very easy. We've done research on this to sort of confirm this. Especially with social media now and with video footage, you can very commonly see how bad a concussion is. Maybe an athlete on the ice lost consciousness. We can track and see how long it takes them to recover and get back onto the ice again. We know that there's no correlation directly with if you lose consciousness or the severity of how it appears visually and the recovery process. It varies individual to individual. And I'll talk a bit more about that, of course, as we go on in the presentation. Myth: you can only sustain a concussion by hitting your head. A lot of people don't know that you can get a concussion by not hitting your head. As we talk about very quickly in the definition of concussion, it's force transmission through up into the brain. So if you hit your torso or your back with enough force, that force can come through the neck into the head and brain, and you can have a concussion without even hitting your head. Myth: rest is the best. Find a dark room, rest until symptoms completely resolve. This is an older school of thought and what we've been telling people for, unfortunately, a long period of time until we've known more about how people recover. And so it's a myth that you shouldn't be doing anything following concussion for recovery. And in actual fact, we're finding that active rest is best. And I'll talk a lot more about that in a few slides. Myth: concussion in sport is just part of the game and should not be considered seriously. So in actual fact, concussion is very common in sport. The prevalence is very high. However, it should be considered extremely seriously. And I think social media and our general conception of concussion, especially with sport, is changing over the last 5-10 years, but it still has a long ways to go. And we definitely want to be considering concussions as a very serious injury. Finally, myth: mouth guards, helmets, they will prevent or stop a concussion. So of course, safety equipment, very important, should be used especially in high-risk activities, but a helmet or mouth guard or any other type of safety equipment will not protect from a concussion in all circumstances. And if there's enough force transmission, even again, like you don't hit your head, but you slam onto the boards in the hockey rink hard enough with your shoulder, you might sustain a concussion. So not relying on safety equipment completely to say you don't have a concussion because you have a helmet on. So starting out with a bit more of the facts here now. So concussion, what is it? So our definition of concussion, it's a traumatic brain injury, of course. Most people generally have an idea that that's the case, and it's because of or caused by biomechanical forces. The big distinction that I talk about with people that I see in the clinic is a concussion is the same or synonymous that when we talk about it as a mild traumatic brain injury. So it's a brain injury, but it's mild. We also talk about and we compare, but it's much different than a serious traumatic brain injury. The difference is functional versus structural. So in a serious traumatic brain injury where it's potentially life-threatening, so let's say there's a bleed in your brain because the forces that you've went through with, like, say, a deceleration accident, you hit your head really hard on a surface very quickly, that could cause potential rupturing and tearing of parts of your brain, and that could be a life-threatening medical emergency. And for that reason, you always want to be checked out by a healthcare practitioner or go to the hospital if you're thinking it's serious enough. But that's a serious traumatic brain injury. And an MRI or a CT, or if you did imaging, you would see changes in the brain or in the neck to sort of suspect, okay, this is what's going on to cause a serious traumatic brain injury. In a mild traumatic brain injury or concussion, you don't see those changes that show up on a CT or MRI. And so because of it, we classify or talk about concussion in the clinic as more of a functional injury. It's based on, okay, how you describe what happened, and then what are you feeling, the symptoms from it. How common is concussion? So common, up to about 30% of high-risk athletes receive a concussion each year. That's massive. So think about it in terms of if you had 12 kids on the soccer field that are 12 years old, let's say, 4 of them out of the 12 have a high risk of having a concussion in one season. And so knowing and understanding that concussion is high in high risk sports. And so I'll just kind of briefly define high risk sports: anything that has a chance of you hitting your head or your shoulders with enough speed. Soccer, hockey, lacrosse, ringette, wrestling. There's a lot of sports that are higher risk for concussion, of course. And so the risks are high, unfortunately, depending, and it varies too, of course. Those risks are the same, I think, over whether you're 12 years of age or if you're a professional athlete, they're high. Approximately 50% of concussions are not recognized or reported. And if there's really one thing I want you to take away from my presentation today, it's that we are doing, unfortunately, a poor job of recognizing and reporting concussion in sport, especially in youth athletes. And there's a number of reasons why, and I'll touch on a few right now. One of the biggest ones is culture surrounding sport and the stereotypes that might surround certain specific sports. So athletes, we know a few things. Athletes are more likely to report a concussion if their teammates are more likely to report, right? But teammates reporting is definitely guided by the coaches and the parents and just the overall culture of that sport itself. So if the mentality, unfortunately, is to suck it up and just keep playing, don't worry, shake it off, that's where we see massive issues with youth and concussion. And so I see this clinically too, where, and I'm just going to move to the next slide for a second, where we can see potentially permanent or long-term effects of concussion. It's not necessarily with just one single concussion or head injury. Generally, we find recovery is almost completely the case in most individuals. It's when you have repeat concussions without a timeline of recovery in between. And we look at that in the clinic, and if for just a good rule of thumb for timeline, we're recommending 4 to 5 weeks from a concussion until getting back to a high-risk activity or sport at the game level, right? And so the reason for that is it takes that long for the body, for the brain, for energy levels to come back up to a level that is not associated with potentially longer-term damage if you were to have another head injury. And I'll go back just one slide again and just mention the very bottom point. The concussions, of course, are greater in games versus practice. Another good point to know. And of course, it has to do with the intensity of play. The risk obviously increases when the athletes are playing at a higher intensity. So I hope that kind of comes across. I'll probably repeat myself a few times throughout this presentation, and some of the ways we can manage and mitigate future repeat concussions. But know that seeking treatment early on is important and critical, but probably the #1 step from like the youth sport level is reporting, right? How to identify a concussion. So I'm going to give you a few tools and a few ideas of what to be thinking about if you are, say, watching youth sports and you see somebody that might, or you suspect might have had a head injury. So to diagnose or identify a concussion, we're really looking for 2 specific things. We're looking for, of course, like I talked about in the definition, the biomechanical forces or mechanism of injury. So you need to have an injury where you suspect, okay, there could have been enough force that might have caused a head injury. So like you see in the photo there, a bad fall in the head, neck, face, but also in the torso or back could cause it as well. You need that, and you need to have some description of symptoms that are related to concussion. Now, the tricky part with concussion is symptoms are have such a large range or variety of them. So you only need one, plus the mechanism for us to suspect and probably be diagnosing with a concussion, right? So I'm going to list a few just because these ones are common that I see with everybody coming in with, or most people anyways, but there's many more than the few I'm going to list here. So no particular order. Headache is common, nausea, fogginess or feeling like you're in a haze, lethargic or kind of just like slowed down. Everything takes a little longer to process, unsteady on the feet, potentially temperament changes. A good analogy to a concussion for those of you who may not have had one is a really bad hangover, but that just doesn't go away by later than that day. That kind of sensation is sort of what we're looking at with people following a head injury. Our management, and sort of where I come in and I see a lot of folks for it, because that's where my training is more specific towards, is how do we manage concussion? And so I want to just touch on the early stages. The first thing you want to do if you're there and you see a concussion on like a soccer field or somebody else in the community is you want to make sure that person gets to a healthcare professional that can assess them appropriately, especially if you're not sure if it's, okay, it could be a concussion, but it could also be a neck or head injury, and it could be serious. And so that's why you'd want to go to the hospital and get looked at, and maybe even get a CT or an MRI to confirm you haven't fractured like a neck bone or had more damage in the brain. So you want to rule out more serious injury first, right? And so see a healthcare professional first. Following that initial assessment with maybe somebody in the hospital, it's recommended that you see somebody that has a bit more concussion training like myself. Now that could also be your family doctor, sometimes chiropractors, and a lot of physiotherapists these days. We're seeing a lot of people and doing a lot more extra education on concussion. One thing I'll say is a lot of the curriculums in medicine and physio and the other health professions don't spend a lot of time in their training of practitioners on concussion. And so extra training is very important and I think helpful on managing people that are having and coming in with concussion. So I'd recommend either talk with your doctor, people that you know, or look online and see who is trained in a little bit more concussion management side of things before progressing back to sport or even back to work, that kind of thing. And so when I see people, I can see them as early as 24 to 48 hours after an injury, and that's when I recommend coming in to see me. We do a lot of things. Mainly, we kind of get a history. We talk about how you're doing overall. What are some of the symptoms, how things presented themselves to cause this head injury. And then I get into some of the more important things. I'll mention a couple of them here. And as I said before in the myths and misconceptions, we no longer want to be recommending from an early stage complete rest. So what I mean by what we've recommended complete rest before is people going into their bedroom, turning off all the lights, no sound or visual stimulation, and lying there sometimes for a week or two until they finally think that they feel better, right? We found that's not a good course of action, primarily because it builds hypersensitivities. And what I mean by that, the analogy that's sort of appropriate here is, imagine what you felt like when you came out of a matinee movie in the middle of summer. It was dark for 2-3 hours watching that movie. You come out, you're blinded by all that light from the middle of the afternoon. The same thing happens if you're in a dark room, except amplified, of course, because you're dealing with all these other head symptoms. So what the recommendation is now, and what should be done from an early standpoint, within even a day or two, is you want to think about it in terms of active rest. All right, starting to do a little bit of light cognitive and physical activities around your house. What that might mean is as little as looking at your phone for a minute or less to check up on emails. It might mean trying to read a little bit or look at a magazine. Maybe that's only a page or so, but trying to do something that's stimulating for your brain, but also stimulating for your body, so your heart rate and your blood changes in position. So getting up and moving is really all we're looking for with light physical activity. So walking around the house, that kind of thing, even from day 2, all right? And then of course, I'll get into a little bit more in the next slide here, what the recovery process might look like. But in terms of returning to sport, especially for youth and higher level athletes, you must be having healthcare professionals clear athletes before returning to sport. As I said earlier, it's the management of not having people going back too early after they've had a concussion. That's going to really help in having not long-term effects of concussion on the brain. So I just wanted to include this. This is a sort of a bit of a guide that we use as a recovery process to returning to normalcy towards whether that's school, whether that's work, whether that's an athlete like a sport. And so the steps 1 to 10, they're set out for a few different reasons. Of course, you can kind of see there's a gradual progression from symptom-limited activity to light cognitive activity, and I want to mention in that physical as well. And then from number 2 to 3, moving back into some normal day-to-day activities. The amount of time between step 1 and 2 is generally about 24 to 48 hours. Between step 2 and 3, depends on the individual. Can be up to 5 days, can be up to a week or longer. I just also maybe should note as well, for those that are wondering, in terms of timeline for full recovery of when people generally feel better from concussion, for most folks, it's 7 to 10 days, right? But we know that the body takes a lot longer to recover than just 7 to 10 days, even if you feel fine. And so because of that, for returning to higher risk activities, that's why from symptom 1 to symptom 10, which is gameplay, we generally space out those steps to make it so you're at least 4 to 5 weeks from the onset of concussion before you're returning to full game play, right? Before that, of course, you can be doing things like drills and things that are on the soccer pitch and exercise related, but just not as high risk until that 4 to 5 weeks is up to allow for the body to fully heal, especially that brain. Post Concussion Syndrome. So some may know about this or have heard or researched about it. It's becoming, I think, more common because I see a lot of people in the clinic for it, and people might often have the question of, I thought you were supposed to get better from a concussion quite quickly, like within that 7 to 10 days or 14 days or so. Some people don't recover within about 2 weeks, right? It says, so I put there approximately 30% of concussion patients don't recover as quickly as others, right? And so I see a lot of people because they're wondering, why am I not better yet? And we label the diagnosis when you've had a concussion and you're more than about 2 weeks out and have not had full recovery of your symptoms, so you're not asymptomatic, we label the term or the diagnosis post-concussion syndrome, or PCS. We don't know exactly why some people get better most people get better within 7 to 10 days and why some people don't. But I have 5 main things or criteria that I look at as a clinician, and we try to sort out, we assess, and then we treat based on where people might be having issues or symptoms maybe start to flare up a bit more when we test these individual elements. And so we look at these 5 things with people that are ongoing with symptoms. So exercise being very important. If people with concussion have symptom provocation or aggravation with increasing exercise, that's something we want to look at, assess, and then test. And then with graded exposure, we can start to introduce more and more light exercise until somebody starts to feel a little bit better with exercise. The metabolic or inflammatory processes that are happening in the body. I talk a lot more about diet. I have some handouts that I provide folks. We can provide them, of course, with this presentation at the end if you would like to see what I provide my patients regarding diet and sort of avoiding pro-inflammatory foods, that kind of thing. The visual and the inner ear systems. So visual dysfunction, balance troubles, that's an element that's affected sometimes with concussion, and that's something we want to look at and treat and focus on recovery with. Whiplash or neck injury. So the muscles of the neck very commonly are also injured when you have a concussion, and really it comes down to forces involved. So generally we know that the force involved to cause a concussion for humans is somewhere around 70 Gs to 120 Gs of force. We know that whiplash can occur in the muscles of the neck within about 5 Gs of force. So because there's such a huge gap and so little the amount of force required to cause whiplash, if you've had enough trauma to cause a concussion, it's very likely you probably also have some neck concerns to be looking at. And the interesting thing about whiplash is a lot of the symptoms are exactly the same as concussion. So sometimes I'll see people that come in that are reporting these concussion symptoms, they hit their head, etc. 5-6 weeks out, not getting better. We look at the neck, it really brings on symptoms. We treat the neck, it gets better, and then they get better. So, and then the final thing, the psychological element of dealing with symptoms for sometimes much longer than 14 days. I've seen people in the clinic that have dealt with symptoms for years, right? So the mental toll it takes on you, wondering if you're ever going to get better, a lot of the unknowns with concussion, I find it really helps just to provide more education and to go through some of these steps and see if we can sequentially and objectively kind of measure and assess on what might be going on to continue those symptoms even years out to have a help or a benefit for recovery of symptoms. Baseline testing. This is one of the more important slides I just like to mention in my presentation. Baseline testing specifically too for younger athletes is so important. And so the idea, the concept for baseline testing is literally we want to find a measurable sort of baseline of where athletes are pre-season before they're going into a higher risk sport or activity, and see where they're at with their mental concentration, their orientation, their physical kind of motor skills, so how quickly their reaction time is, their balance, etc. So that we have basically a handout and information of where they are on a good day prior to any head injury. And then hopefully we never see them again. But if they do have an injury or concussion, because the risks of concussion are so high, as I mentioned earlier, if they do have one in the season, then we can use that baseline test preseason to measure how their recovery process will look like. So it's hard to treat and to measure when and really recommend accurately when an athlete should return to sport when we don't have a baseline test. Because on an average day, most of us could probably say we feel a little bit lethargic and fatigued, and maybe we have a slight headache, and maybe our balance isn't that great right now, right? So if that's our norm, following a concussion and you've been dealing with it for a few weeks, you might have forgotten that you might not be perfect. And so the recovery timeline can be a lot more, I find, kind of muddled and foggy when it comes to, okay, when's the best time for you to go back to playing hockey, right? So having that baseline test is critical. And we're starting to see more teams come in to our clinic and do a baseline test preseason. And it's the reports from what they've been telling us are it's extremely beneficial and helpful, and gives parents and obviously athletes and coaches a lot more assurance that the right things are being done for management if that were to happen, a concussion were to happen in the season. Switching gears to more education. So I just want to mention now for everyone that there's more education that's out there, especially if you're involved and have a child or know somebody that's part of a sports team, or you're a coach or a trainer. This is a wonderful course that I recommend taking. It's through the same organization that I took training from. It's a 6-module online course. It takes about an hour. You get a certificate at the end. It goes over some of the stuff that I've talked about, but in more detail. How to recognize concussion, how to manage, and what are the steps you should be taking. And the other thing which I really like about this program and this course is they provide some more technology-based information so that you can download like a tracker app, you can have a profile, and we set this up actually with a lot of our baseline test athletes. The whole team will download this app, and they'll be part of the app, and the information I see as a clinician is different than the coach or the parent or the athlete themselves. But it provides information, it provides a means to track sort of the communication between someone like myself or a doctor and the athlete or the coach of when, okay, is it a good time to return to sports? You can kind of see it's color-coded. And so that's built in, and that's quite a nice program that seems to be working well for some teams that we've been implementing it with. So just to end or conclude with my talk here, some key points. Significant impact plus either just one symptom of concussion is really what we would call it a concussion, how we define it. A majority of concussions, about half of them, are not recognized or reported, which is way, way too high. So we need to be better at changing the culture, at looking at educating ourselves and our athletes and our coaches regarding concussion and the severity of concussion if it's not dealt with and managed appropriately. Athletes are not taken off the field and allowed to rest appropriately until put back on. We want to report early, and we want to see someone for concussion, healthcare professional, very quickly so that you obviously get the right information and you're doing the right steps for recovery. And the baseline testing for youth and athletes, whether you're youth or you're a professional athlete, because professional sports teams have been doing this for years, baseline testing, youth athletes should be doing it too, regardless if you're just at the community level or higher. So the importance of baseline testing. And that's what I have for today. I'm sure there's probably a few questions. So I'd like to maybe now take a few of the questions that might have come up there in the chat.
Awesome. Thanks very much, Matthias. I really appreciated that, particularly the information regarding the sideline coaching course and the symptom tracker and the app were really informative. So thank you very much. We do have quite a few questions, and I'm just going to kind of go through them in sequential order. Brief kind of disclaimer here. If we don't get to your question now, we're also going to have another Q&A period following our presentation from Dr. Virji-Babul. So if your question doesn't get addressed right now, excuse me, just know that we're coming around to it. So the first one from Deborah, thank you, Matthias, for your presentation. I'm wondering, when you see older adults who have fallen and sustained a concussion, if they need to be cleared by a doctor for physical activity in case they have suffered a fragility fracture in their neck.
Absolutely, yes. No, especially when we're looking at more serious injury that's fracture or potential like structural damage in the brain. Absolutely, that you want to be following your doctor's advice, your healthcare practitioner's advice regarding activity. And seeing someone like myself, even if you've been cleared to follow up with a physio regarding a concussion, we will talk about that, and that'll be something we discuss, and that will definitely drive how I may work through some of the steps of concussion. We may not introduce exercise for quite some time if that's the case. Yeah.
Awesome. Thank you. So the next question is from Vera, and I imagine that it's more focused on PCS or post-concussion syndrome. Is there a support place to assist the people because their life has changed? I imagine that it's the question is geared towards people that have consistent symptoms that range over time. What would be your suggestion? How would those people look out for supports?
Yeah, like it depends on the location. I realize not everyone's in Prince George. I'm unaware of all the different resources that are available in different cities in Prince George. I recommend the Brain Injury or Brain Health Group. That's located downtown. There's a great community of members there, and there's a lot of information that's kind of brought up through that program. And then online too, I've found that a lot of people that have been that I see and talk about concussion and post-concussion syndrome have found good resources online, even groups on Facebook, that kind of thing, that deal with longer term symptoms of concussion.
Great. Thanks, Matthias. We're just going to keep ripping through them here quickly. Elizabeth, how long can PCS, post-concussion syndrome, last for youth? So I guess another part of that question could be, is there a different recovery timeline for youth as opposed to adults for PCS?
Not that I'm aware of, no. And post-concussion syndrome, there's a lot, unfortunately, of gray area and unknowns still, because it's really a definition of we don't know why. A syndrome is just a collection of signs and symptoms. So post-concussion syndrome is just exactly that. And so those 5 things I mentioned are the main things that we've currently, like from the education that I've gotten and what's kind of done across North America for this program, we look at and we assess and treat. And some folks I see have improvement from one or all of treating all of those. Some people, unfortunately, are not getting better even after we go through all of those things. And I think it's just so multifactorial when it comes to the brain, and the history too is really important. Like I see, unfortunately, a lot of folks that have had multiple head injuries and maybe haven't had that timeline of recovery. And I mentioned earlier in the presentation there that the chances of permanent brain damage and dysfunction are higher in those that have had repeat concussions without that proper timeline of recovery. So that obviously can play a big role too in people's recovery timeline or process. Hopefully I answer that.
Okay, thank you.
Yeah.
So we have a couple questions and a couple comments regarding recording and resources and presentations. Just to reiterate what's been said in the chat box, the recording will certainly be available post-session for anybody that might have missed it, or importantly want to review some of the things that we talked about. And any and all resources, including slides that can be made available, will be made available. Anybody that's registered will receive that email with all of those links directly. There was another interesting question from Marge, Matthias, and that was, how do we measure visual tracking and processing speed?
So, of course, I'm a physiotherapist. So, first of all, I do a VOMS test, it's called, so visual ocular motor screen, and so that's the main thing I utilize. It's fairly simple as a practitioner to implement, and so I do a few different visual spatial tracking tests that doesn't require much for equipment. If this is a big area of concern for people that I see, I immediately refer them to an optometrist. And so another good thing to know is there's generally a good amount of optometrists out there that obviously see folks with concussion and have done extra training and for management of concussion. So in Prince George, Dr. Luce is a really good optometrist that sees a lot of folks that I also see for concussion that have a lot of visual, spatial, or visual concerns that are not getting better, obviously, within that short time frame. So that's sort of my answer to that. Besides that, yeah, I don't have my expertise is not in that field, so I leave that to people smarter than me on that.
We all have our gifts, and yours is obviously using these tools to help people get better in a day-to-day level, right? So last question, then we're going to move on to Dr. Virji-Babul. And I apologize. We'll get to all these questions by the end of the session. Tracker app, wonderful idea. Is it available in the field in BC? So I imagine this question is more, can we access this app in BC?
Absolutely. You can download it right now if you go to the App Store, I believe on Google or Apple. yeah, it's a very easy to, you just find it. You can type it in and on the Google or the app search and download it. And it's nice because it has some obviously some very important information, and then you can just use it yourself. Or of course, get your, like if you have a team or you have other athletes, you can get all of them on it as well. And then from there, you can obviously link that with a clinic like the one that we have at Physio North that has complete concussion management clinicians. So if you go on and Google concussion physiotherapist or concussion management even, BC, if complete concussion management comes up, there's a nice page that shows where all of the different clinics are, and it's not just physios, of course, it can be doctors, some chiros, I believe, nurse practitioners that have taken the training I have, and they come up and pop up on that map, and they're all over BC. Unfortunately, in the north, I believe we're the only ones that have this training. Otherwise, Williams Lake, I believe, has a clinic, and then you're having to look further south. But at least you can kind of find the clinics that have folks like myself. And then if you download the app or you have your team on it, it's very easy then to link all the information to that app from what we end up getting and what we end up doing with the program as well. Because I input a lot of information in that program. And one of the nice things about the CCMI, the Complete Concussion Management Program, is it's also a research-based program. So it's taking not all like personal information, but it's taking and tracking, reporting the concussions in that database, and it's giving us a much more larger understanding of how we're managing all across North America and a few other countries overseas here now, concussion.
Great. Awesome. Thank you. So without further ado, Dr. Virji-Babul, would you mind kind of taking us away here? We can, yes.
Okay, perfect. So thank you, everybody. My name is Virji-Babul. I'm a physiotherapist and a neuroscientist and an associate professor in the Department of Physical Therapy at UBC. And I just want to thank Matthias for a great presentation. He's set the sort of foundation and the background for a lot of what I'm going to be talking about. And my focus really is going to be on neuroimaging. What does it tell us about the effects of concussion? So I want to start with land acknowledgement and start by expressing my deep gratitude to the Coast Salish peoples. I live in Deep Cove, so I want to acknowledge that I live on the traditional, ancestral, and unceded territory of the Squamish, Tsleil-Waututh, and Musqueam nations. I do reflect deeply on the impacts of colonialism, and I value the opportunity to learn, live, and share experiences on this traditional territory. And I really want to thank you all for inviting me to come and talk about the work that I'm doing. So I want to start by, Matthias has given us a good definition of concussion, that it is a mild traumatic brain injury. We know that concussion is considered a silent epidemic. And why is that? Well, it seems that there has been an increase in the number of concussions, and that might be due to a number of reasons. One is that there seems to be more awareness of concussions, and so there's more reporting of that. So we don't know if it actually means that the number of actual concussions are increasing, or whether it's the awareness. The other reason seems to be, especially in youth, is that there are changes in the way the game is played. There are changes in the equipment. The equipment is getting harder for the sports like ice hockey and football, as you can see on here. The helmets are not just there to try and protect the players, but they're actually getting harder in the sense that sometimes they're actually causing injury to other players, whether this is in football or ice hockey. And in terms of the changes in the brain, we still have a very poor understanding of actually what's going on in the brain. But the most important concern really from this, as Matthias also mentioned, is that we think that repeated concussions especially may be leading to future neuropathology. So future neurological conditions such as dementia, Alzheimer's disease, Parkinson's disease seems to be associated with repeated concussions. And this is, of course, a big concern, especially for the youth, and all the efforts to try and decrease the number of concussions, to try and change the rules of games so that we really try and protect our youth especially. One thing I want to mention is that we know that there are higher rates of death and hospitalizations from head injuries among Indigenous populations compared to non-Indigenous populations. And we really don't understand the reason for this. Why would it be so different? I think one of the reasons is that we are starting to understand that our baseline conditions of our brain is really impacted by brain injury. So if people have experienced chronic stress, if they've had previous trauma, whether this is physical, emotional, psychological, this will affect the baseline state of the brain and maybe make them more predisposed to having particular kinds of brain injury or to have more severe injuries. But we still have very little knowledge about why it is that the Indigenous population seems to have these high rates. My intention today is really to give you the basic science and the scientific view of how we understand concussion. We know that the effects are very diffuse and microscopic, and typically on CT scans and just regular MRIs, we really can't see the structural effects of the concussion. But over the last 10 years, with advanced imaging, and many of this advanced imaging techniques have actually been developed at UBC, and I will be showing you some of these changes that we see. We can now actually start to see the structural changes that are happening in the brain, the micro tears that occur as a result of the brain injury. And that's what I want to focus on. But I also want to really acknowledge that what I'll be showing you today is a very particular window of what's happening in terms of the physical changes that we're seeing in the brain. And all of that has to be put into context with how the person who's experienced a concussion, what supports they have, what previous kinds of trauma they might have experienced, whether it's the supports around their family or within their community. All of this is going to impact how they actually recover from the concussion. So I just want to acknowledge that at the start. So I like to start usually my presentation by showing a picture of our Milky Way galaxy. And we know that there are approximately 200 to 400 billion stars in our galaxy. And when we think about this, this is really, I'm trying to set the stage for the context, because we often say that there's many cells in our brain as there are stars in our galaxy. And this is approximately true. There are about 100 billion neurons in the brain. So that gives you an idea of the scope, but also I really want to kind of give you the context that there is tremendous, tremendous complexity in the brain. We're talking about 100 billion neurons. And if you have an injury in just one little part of your brain, because the brain is so connected, it's like a network, that an injury in one particular part of the brain is really going to affect the functioning of the entire brain. And this is particularly the case when we look at the most earliest periods of brain development. We know that the infancy, 0 to 5 years, is a time where there's tremendous growth in the brain. The second most dynamic period of the brain is actually during adolescence. And adolescence starts about from the onset of puberty till about the time when the person has become independent. So it's really about the ages from about 10 to 12 years of age until about 20 to 25. And this is a very protracted period of time where the brain is just exploding. There's tremendous development that's happening in the brain, and there hasn't actually been a lot of public health education about the importance of the adolescent stage of development. And over the last 10 years, findings from neuroscience are showing that this period of development is when there's tremendous learning that's happening. There are major changes that are happening in the system, in the adolescent brain, in relation to thinking skills, in relation to emotional skills, to how adolescents actually experience the environment around them, how they problem solve, the fact that they are more tuned to their peers, less to their family. They're starting to, kind of separate themselves from their family influence and become more influenced by their peers. Their social learning this is the most dynamic and plastic period of development. And for that reason, adolescent is also a very vulnerable time because the brain is not complete in its development. When there's an injury to the brain, it's actually going to affect the development of the brain as it continues into adulthood. And so today I want to focus just on this adolescent period and to talk about the fact that when you have an injury, whether it's a physical injury or whether it's an emotional or psychological injury that is superimposed on top of a rapidly changing brain, the effects of that can be quite devastating. In some cases, can occur for a longer time. But because this is such a dynamic period of development, the recovery from concussion can also be much faster if it's done in the right way. So this is just to set the stage to say that adolescent is a very dynamic period of development, and we really need to think about how we will hone our recovery and try and include the family and the community and other supports in helping people, adolescents who are actually recovering from any kind of brain injury. So I want to just show you what's actually happening inside the brain when you have a blow to the head. So this slide shows you, there's the brain that's inside, and there's the skull on the outside. And what you see is that when you have a blow to the head or to the body, the brain is basically slamming inside the skull. So it kind of hits in the front of the skull, and then it hits on the back of the skull. So the two areas are actually very vulnerable to injury from blow. And what happens on the to the white matter, so if we look at this gives you a cross section of the brain. And what you can see here is that you actually have shearing and tearing that is going on that actually is causing tearing to the fibers that connect the two parts of the hemisphere. And we can now actually visualize this on advanced imaging. So before I show you what we can see in adolescence, I want to just talk about whether humans are the only ones who are susceptible to brain injury. What about birds and animals? Do we see birds and animals who look like they've had a concussion, being in a fog? What is it about birds, for instance? Do woodpeckers get brain injuries? We know that woodpeckers hit the surface of trees at a rate of about 20 times a second and about 12,000 times a day with staggering forces, as you can see here. But we know that woodpeckers don't seem to get brain injuries. And why is that? Well, it turns out that the bird brain is actually an amazing structure that has actually developed in a way to protect the brain from getting an injury. So you'll see here that there's this bone that's actually acting as a seatbelt. The woodpecker has a number of different kinds of adaptations that it's made. It has a spongy bone, it has the seatbelt. You'll see that its brain is right, almost very close to the skull itself. So it's actually designed in a way to protect it from getting a concussion. We know that there are other animals that, like rams, for instance, where you might have seen pictures of rams actually butting their horns together. They have specific adaptations as well that are designed for them to be hitting their head. Humans don't have these adaptations, as you saw from the previous videos. So we are, unlike birds and animals, extremely vulnerable to the effects of getting a blow to the head or to the body. And this is essentially what I study. I look at what the structural and functional signatures are in the brain. So when I talk about structure, I'm talking about what does the brain actually look like. So for example, if you had an injury to your knee, you might have changes in the bones, for instance, if there was osteoarthritis, or maybe changes to the ligaments. And we can now visualize that through imaging. We can see that there are actually changes in the ligaments and the bones. That's what I mean by the structure. And so I look at the structure in the brain. I also look at the structure, the signatures of functional changes. So if we were talking about the knee again, the functional changes would be the effects that the changes in structure caused on walking, for instance, or running, or going up the stairs. All of these functions would be affected by the structural injury of the bone. And in the same way, what I look at with the concussion, the functional changes with concussion, is what are the effects on thinking? What are the effects on memory, on problem solving? How are emotions affected by the structural changes that we actually see? So if I look at when I talk about structure, we know that there are neurons or cells in the brain, and there's axons that send information from one neuron to another. And the axons are covered by something called myelin. And essentially this is insulation. The insulation just helps the information travel much faster. And the area of the brain that seems to be particularly affected structurally by a blow to the head or the body is called the corpus callosum. And this corpus callosum, this is taken from an advanced MRI image that basically gives an idea of what these fibers look like. And these are the biggest, largest fibers, white matter tracks that we can see. And these are the fibers that connect the two parts of the brain. So when there is a blow to the head or the body, what happens is that the brain actually is starting to shake inside the skull. And this shaking actually causes tears in these fibers that connect the two hemispheres of the body, of the brain rather, sorry. So when we look at the data from youth, this was one of the first studies that we did, was to look at trying to visualize the structural changes in the brain. Here is just a cross section of an adolescent. So what we did was we looked at adolescents who were between 14 to 17 years of age, and they were seen between 2 weeks and 2 months after their sports-related concussion. So, and the example that I'm showing you here, this is a 15-year-old youth, and you can see this is a slice through the brain. This part right here is the corpus callosum, which shows the fibers in between the two hemispheres of the brain. And the areas of yellow actually show you, the yellow and the red show you areas where there's damage, where there's these micro tears that I was talking about. And what I'm showing you here in this concussion, in the slide from that's labeled concussion, is somebody who is at 2 months post-concussion, post the time that they had an injury. And this is someone who had an injury from playing ice hockey. And we can see that there are still tears that are visible in the brain scan, even 2 months after they've had their initial injury. Now, does this mean that this person is still experiencing symptoms? Most likely not. What we're seeing is that there really is a disconnect between what people report as their symptoms and what we're actually seeing in the brain. It seems like the brain changes and the symptoms are actually measuring very different things. So a lot of the research that I've been doing, we can see that there are changes that are happening in the brain up to 2 months, up to 6 months post-concussion, even after a single concussion. But these are not always related to their symptoms. People report a lot of symptoms, the kind of symptoms that Matthias mentioned in terms of the headache, the feeling like they're in a fog. Often they might have visual disturbances. But many of these seem to resolve. They do take longer in adolescence, but they seem to resolve within a couple of weeks. But the changes in the brain don't seem to resolve. Very often they don't resolve until between 4 to 6 months after they've had their after they've had their injury, and they resolved in very different ways. These changes after they've recovered, the changes that we see in the brain are not actually going back to baseline, not the way that the adolescents who don't have a concussion. There are changes that are happening in the pathways, and I'll show you what I mean by that. So let me go over some of these other changes that we see. This is a technique that was developed at UBC called myelin imaging. And myelin imaging is essentially imaging the white matter or the insulation that is wrapping around the axons. And what you see here, if you look at the top part of the slide, I'm showing you the changes in the myelin, which are these long tracks that are in yellow. These are, and the one that's going across. So the fibers that are going across that connect the two hemispheres of the brain, and the tracks, the long tracks that are sending information about motor function, about cognition, about emotion. This is what we can now visualize on these kinds of scans. And what you see here, what I've done is given you plots of individual people at different ages. So the first image on the very left is an 18-year-old male. The second one is a 36-year-old male. And the very last one on the right is a 51-year-old male. And you will notice that across these ages, what we see is that the amount of yellow that we see here in the very long tracks, as well as the tracks that are going across, are actually thicker. What we see is that over time, and there seems to be an effect also of the number of years of education, that this myelin actually increases with age. And that increase seems to go on until about the age of 50. And we see this now even in our healthy participants, that there is an effect of the amount of education that people have in the myelin, which is really telling us about the plasticity of the brain, that as we learn more, as we're actively involved and getting stimulation from our environment and being actively engaged, this actually causes changes in the brain itself, even up to the age of 50. Now, the bottom slide shows you what happens after a brain injury. So on the very bottom left is a slide that shows an 18-year-old male who's had several concussions from playing rugby. And you will notice that compared to the top with the healthy control, there's a lot less of the yellow material, which means that there is some loss of myelin that's happening as a result of the number of concussions that this person has had. This is somebody who was in, again, a sports-related concussion, a 35-year-old male who was also playing rugby, and you see a lot less myelin compared to the healthy control. The last slide on the right is a 51-year-old male, or female rather, and she had a terrible car accident. She was driving during a snowstorm, got hit from behind in her car, and she actually went right through the windshield and crashed right through it. And if you look at the amount of myelin comparing hers to the healthy controls, you see that there's a lot less myelin in her scans now. So using these kind of techniques, we're actually now able to visualize the structural changes that are happening in the brain as a result of concussion, sort of the whole range from very mild brain injury to more severe, which this woman would be, the 51-year-old who's experienced the car accident. So what I'm now interested in looking at is how do these changes in structure that we see in the brain correspond to the changes in function? And the way that we do the functional and the structural imaging is through advanced MRI. And in terms of the functional imaging, a lot of people will think that, well, you'll probably need to actually do a task that involves some kind of a thinking task or a movement task to try and understand what's happening when there's actually some function going on in the brain. But in fact, what we do is we bring people into the scanner and we just ask them to close their eyes and just rest and not think about anything, but also not to fall asleep, because sleeping actually changes what happens inside the brain. So we ask kids to come in and just to keep their eyes closed and not do anything. And why is that? So I want to show you what the brain actually looks like when you're just resting and not actually doing anything. So this is a simulation showing that the brain at rest is not actually at rest. Your brain is never at rest. Your brain is constantly active. Different parts of the brain are constantly talking to each other. And in fact, the most amount of blood that's used, or oxygen consumption, is actually when your brain is at rest. If I was to now ask somebody to, while they were in the scanner, to make a movement, you will see a little bit more activity in sort of the motor areas of the brain, the movement areas. Or if I was to ask them to do a memory task, we will see a little bit extra activity in the memory areas of the brain. But we will still see all this, what we would call background activity, that's going on in the brain at rest, because your brain is constantly communicating, constantly different parts are talking to each other in the very same way that we would think about the internet or the World Wide Web. There isn't a time that there isn't any activity in the web, right? There's always background activity that's going on. So that is why the work that I do, I really focus on looking just at what's happening at rest, because it really gives us, it's a very sensitive way of actually detecting what sort of changes are happening functionally in the brain. We know that, so I mentioned sleep. When people are when sleeping, their brain activity changes to a different pattern. Also, when we have people in there who have particular injuries, if they have Alzheimer's or if they have Parkinson's, their baseline brain activity is very different. So this, for us, is it's a very sensitive way to look at what's actually changing in the brain. And the way that we look at the activity then is to consider the brain as a network. So what I'm showing you here is a transportation network. And this is kind of how we actually think about the brain, in the same network as this. So here, this is a map of the world. And you see that there are these lines that are going from one area of the world to another. So say if we were taking a route from, say, Toronto to London, this would be a route that's highly traveled and a lot of flights going back and forth between Toronto and London, let's say. So Toronto and London would be seen as hub areas. And in the same way, we have hub areas in the brain. One of the major hubs in the brain is in the frontal areas of our brain. And the frontal areas of the brain are what control your thinking skills. They control your problem-solving skills. They control parts of your emotional skills. So it's a very important hub. Now, think about what would happen if there was a snowstorm in Toronto. The flights would have to get rerouted to, say, Ottawa, or maybe to Montreal, to another area, and you would have to take a different path to get to London. In the same way, when there's an injury in the brain, it's like having a snowstorm in the brain actually reroutes those connections so that different pathways are taken. And so this is what I was saying, is that when we talk about the symptoms and what happens in the brain, we're actually looking at very different things. Your brain is actually capable of rerouting the connections. And I will show you in the next couple of slides how that's actually done after there's been a snowstorm in the brain. So just looking at, this is kind of a busy slide, but really what I want to show you is that just qualitatively, when we ask the adolescents to just sit in the scanner and rest, we can start to see different networks that we can actually capture from this resting state. And we see here on the left that there are particular networks. Don't worry too much about the names of them, but these yellow blobs actually show you particular networks that we can extract. Some of these are related to cognition, to your functioning, to your thinking skills. Others are related to motor skills. Others are related to emotional skills. But the thing that I want you to really focus on is you see on the right side that these networks qualitatively are much more fragmented. They're much more scattered compared to the networks in the healthy control brain. So there is actually a change in the function of how the brain is functioning as a result of this concussion. Now, this is the kind of information we get from the advanced MRI. I also do a lot of work with resting state EEG. Part of the reason is, well, there's a couple of reasons. One is kids often don't like to be in the MRI. You have to be very still, otherwise you get all sorts of noise in the signal, and they don't like doing that. You have to sit still for about 15 minutes. It's very hard. But the other more important reason is that the orthodontists have kind of taken over the mouths of adolescent children. Many of them have braces, and you cannot have any metal when you go into the MRI. And so the number of kids that have braces now is just increasing exponentially. And so we can't often get them into the MRI. So I started to use something called EEG, which essentially looks like what you see here on the screen. There are electrodes that are put on a cap that we put on top of the head. And these electrodes actually can capture the signals from the brain through the skull. And we do a lot of the similar types of network analysis with the EEG as we had done with the MRI. Our first study, we actually started by having 54 adolescents who were in the Whitecaps program several years ago. And what we found from looking at this data was that there are changes in the functional areas around the frontal areas of the brain. So as I said, the frontal areas is responsible for your thinking skills, your cognitive skills, memory, and also your emotional skills as well. So all of those areas are particularly affected. The second area that we see a lot of changes is in the back of the brain. So Matthias talked about a lot of the visual effects that people often see, and that seems to be related to the fact that the back of the brain, which is what information about your visual system is coming in to the back of your brain for processing, is where we see a lot of changes in the functional areas. But what I wanted to show here is, as I talked about in the flight path, that we had, the flight paths are rerouted when there's a snowstorm. We can now see the effects of the snowstorm on the adolescent brain. So on the top, what I'm showing here is a brain, and those round circles are particular areas in the brain. So in the very front of the brain, we have all the frontal areas, and the back of the brain are the visual areas. And these arrows tell you about the strength of the connections. So just like the flight path that I showed, where there were very strong connections between, say, Toronto and London, this is what we see in the healthy controls, are the red areas. But if you look at the very last figure that's labeled D, that tells you all the different connections of various strengths in the brain. And you see that this is again at rest with the EEG. These are all the channels of information. These are all the ways that the brain is communicating with different parts of the brain, starting from the frontal all the way to the back of the head, and in between the two hemispheres of the brain as well. Now, the bottom layer shows you on average how these paths have been rerouted. So you see here, if we just go to the very last one, you'll notice that the pathways, these red areas especially, are actually going in a different direction. We now see more connections that are happening between the two hemispheres of the brain. So the entire pathway of the brain has actually changed because of the fact that there's been this injury to the brain as a result of the concussion. Now, what we don't know right now is, are these new pathways just as good as the original pathways that are there in the healthy concussed brain. And that's an area that I'm really involved in right now, is to try and understand whether the new organization of the brain as a result of the concussion is a way that the brain is compensating for the brain injury, or whether it's actually reflecting some kind of impairment that's happening in the brain. So all of this, what I'm showing you here, are kids who just had one concussion. So these are the effects of having just a single concussion, and they are within 2 weeks of injury. So what we're now doing is trying to recruit kids so that we can get information about the changes in their brain at least up until 1 year post their initial injury, to see if these pathways actually go back to what we would see in the healthy controls, or do they continue along this trajectory, and what this actually means for them. So I wanted to just put in the slide, and Matthias already talked about it, so I won't spend too much time on it, about the fact that rest is really not considered the best medication, the best medicine rather, for post-acute concussion, that really prolonged or complete rest or sitting in a dark room has been shown to be actually can prolong the symptoms. And what we really need to do is to start with gradual exercises. And we have a study that's going on right now to actually look at how exercise might actually facilitate the recovery of concussion, and also to see if what types of exercise, how often would we have to do the exercise to actually see this changes in recovery. I don't have enough data to talk about that yet, but we're already seeing that our group that's involved in exercise, we're actually seeing that we are seeing the effects of recovery happening much faster with the gradual exercise. So I just want to end by talking about some of the challenges in doing this research and the challenges in the field of concussion in general. We know that the initial experience of concussion is extremely variable. People experience concussion in very different ways. You can have two people who have the same injury, but they'll experience it very differently. What we see in the brain may be very similar, but their subjective experience of the concussion may be very different. How long the symptoms go on for may be very variable, and that it is based, it's probably has a lot to do with their baseline initial conditions, you know, whether they've experienced trauma, whether they've had any other kinds of injuries, whether they've had multiple concussions is going to be affecting how they respond to that. There are currently no brain-based objective tools to make a diagnosis of concussion and to really evaluate the severity. And that's something else that I'm working on, is to try and develop, sort of use machine learning and advanced artificial intelligence to kind of take this data that I'm gathering from the EEG and see if there's ways that we can make the diagnosis through using machine learning. The other key challenge, and I really want to stress this, is that we really have very little or no information on how concussion impacts Indigenous youth and adults. And this is a really big gap in the field. And I think a lot more effort needs to be put into this for us to try and understand the experience of this, and to really understand how to best manage it. We know that the recovery is going to depend on the supports from the family and from the community. And it's going to, you know, a lot of youth who experience concussion have mental health issues. Some of them are experiencing depression as a result of this, because their symptoms seem to go on for so much longer than what we expect. And these are big gaps in the field that we really need to think about how to address this and how best to promote recovery. So I've given you a small window of understanding some of the changes that are happening in the brain, but I want to again kind of give the context that we need to understand much more about the supports, the psychology of this, the community impacts, how that influences the changes we see in the brain, but also the recovery of that. So I just want to end by thanking the people who fund me for doing this research, all my community partners, all the youth who come out and bravely sit there for quietly while we record their brain signals, and of course all my students and collaborators who have done this work with me. So thank you very much, and I will stop sharing so people can, I see there's a lot of questions, but I didn't have time to look at that as I was speaking.
That's fine. Thank you very much for your presentation, Doctor. I really appreciated it. It had many questions that kind of popped up throughout. And I think one thing I just want to say before we kind of launch into questions for both of you is that, you know, it's a real shame that given the prevalence of concussion and how devastating we know that it can be over the long term if not treated and recognized appropriately, it's a real shame that I feel that we're still so far behind where we need to be, especially in the context of, you know, putting our youth in sports that ultimately risk their long-term mental health or could possibly risk their long-term mental health. I think that I really appreciate the work that both of you are doing, different lenses, both in helping us kind of get through this as communities. So I actually just had one question, and you might have answered it towards the end, but I wanted to clarify. A lot of the functional changes that you showed, Doctor, have you done any research, or has there been any studies looking into any of those functional changes carrying over into those patients that are suffering from PCS or have long-term effects of concussion, or they're seeing long-term symptoms?
Yeah, with post-concussion, yeah. There, you know, a lot of the, most of this kind of functional studies have gone up to 3 months or 6 months, but not up to 1 year. And we see that there are definitely changes that are happening in the brain up to at least 6 months post injury, for sure. Yeah.
Awesome. Thank you. So this next question from Matthias, it's regarding mentioning falls in older adults. And the question is, how is this information being shared for clinicians working within this population? And I think to contextualize it for your clinical experience, how are you communicating that with physicians? I suppose the importance of looking into concussion for that.
Thanks for that. That's a great question. So one, I almost always work in conjunction with the general practitioner, the family doctor of the individual that's coming and see me. A lot of cases, a lot more of the doctors in town are starting to recognize that we do concussion rehab at our clinic. And so we're referring people that they see initially saying, yeah, I just had this head injury. What do I do? What kind of information is out there? Who do I go see? They recommend that they come to me. Or one of the other physios that works at the clinic, because they all have the same training as well. And then what I'll do is I'll keep the doctor, like with most other injuries as well, just the same as with concussion, I'll keep them updated. And I usually either through a phone call or through some notes, provide that doctor an update. And so they're constantly in the loop. So that's sort of how I manage it between like practitioners. And then trying to do more things like this to provide more information out there, and maybe not everybody listening is just doesn't have any education in the healthcare field. Maybe there are folks that are nurses or doctors or that didn't know as much about concussion, and so hopefully this can kind of reach out and get to other people the same way.
I love the response, particularly the piece you said at the end. You know, when I frame your response, it's great that you are so engaged with physicians, but I think the other side of that coin is that requires that physician to engage in that process, right? And I think that continuing to raise awareness, not just for the wider community, but for even those that, you know, maybe older individuals that have been in the profession for a long time, during which the stances on concussion has changed significantly, it's important that we continue to raise awareness on this. So thanks very much for that, Matthias. So our next question from Deborah, and this could be for either of you, whichever one wants to kind of jump in and answer it. Given different recovery trajectories and symptom presentation in young versus old, males versus females, does this influence your assessment in any way when you're assessing patients from these different demographics? Is there anything you change?
I'll maybe just quickly speak first. Yes, and so maybe first of all, let's say everybody I see is always different than the last person. Like everyone is unique and has their own story to tell, and likely had a different mechanism or description of what might have occurred for them to come in and see me for concussion. And based on age, absolutely, and sex, gender, all of that has an impact on how we might proceed with recovery and how we might discuss recovery, like kind of planning and implementation. I'll just mention, I didn't really maybe say this point in my presentation as much, but the number one thing that I think and what people also kind of tell me that's helpful when I see people in the clinic from a clinical standpoint is it's the education. That's the number one thing everyone always is saying that is the most beneficial. I'm not doing anything crazy in terms of like, you know, I'm giving them education on what to be doing and how to help themselves. A lot of time, and why I love concussion so much and dealing with people with concussion is I'm just giving the tools and the education for then that person to go out and implement them and to try that as a best practice in their life. It's not like they're required to really follow up. And I actually don't see people with concussion a lot. Sometimes 2 to 4 times max, because a lot of it's more tools that you can utilize in your everyday day-to life and ways of thinking to maximize how you're going to recover and how your body's going to recover on its own, right? So it's the post-concussion syndrome, the PCS, that I see folks a little bit more regularly on in the initial stages for more assessment. But then again, a lot of it's tools to then utilize yourself. And so, of course, based on your age and a lot of other factors, we may discuss certain things a bit more than others based on how you're presenting.
Right. Awesome.
Can I just add to that? One of the big issues and biases in the scientific literature is that a lot of studies have primarily been done on white males. And this has been a big issue in many areas, not just in neuroscience. And I'm actually guilty of this myself because I started doing this, the studies on the white caps, and they were all adolescent males. And I'm trying to rectify that now because we're starting to see more data that's coming out that show that that women, girls actually experience the concussion very differently. Their symptoms seem to be different, but the changes in the brain are also very different. So my current PhD student, Rebecca Kenny, is actually working with the varsity soccer team at UBC. And we've been collecting data. She's been going out there every day, videotaping all their games and practices so that we can look at the difference between the practice and games, but also collecting their EEG data. And we will then compare how they respond to the concussion, how the women respond to what the data is that we've already been collecting on the males. And hopefully that will give us some really, really rich information to try and see what the gender differences are in terms of the brain injury.
Great. Yeah, fantastic. I think I want to wrap a piece up in your response there, Doctor, that you know, this dearth of data on specifically on Indigenous athletes and Indigenous youth. I think one of the things I can't help but think about is access to resources, access to research projects, and access to physiotherapists on the regular basis. And then taking that a step further, access to physiotherapists with specific training and recovery, because so much of this is done post your traditional curriculum, if I'm not mistaken, Matthias. So, you know, it's fantastic that a lot of these, taking the app, for example, amazing that resource exists. Absolutely. But are we really creating, are those resources really being created and allocated in an equal and fair manner? Do you understand what I'm saying? If baseline testing is another great example, but probably doesn't come for free. So how are we really looking to impact not just Indigenous communities, but all teams and all youth at all levels that maybe don't, you know, if you play for a silver, which for those that don't play soccer in a youth level, it's a lower kind of grade of competition. If you play for a silver team, does that team still have the same kind of access to resources as does a gold team, as an example? And particularly when we take a look at Indigenous sport, which has consistently been underfunded, Um, you know, having been someone that works in Indigenous sport, it's something that kind of came across my mind, and something for all of us to think about, I think, is that these long-term, long-lasting impacts of colonization and racism even trickle over into healthcare and into research. So thanks very much for bringing that up, Doctor. I appreciate it. So on to the next questions. So there is one from Susan, who said, I thought recent research cast doubt on the reliability and usefulness of baseline testing due to the range of the day-to-day variability. So I was wondering if one of you would like to respond to that. My initial thought was that there would be a day-to-day variability, but at least you would still have some baseline to work on, as opposed to having nothing at all. But that's maybe my uneducated opinion. Do you guys have a response for it?
Yeah, no, that's sort of right what you're thinking there too. I think the big thing is it depends on what kind of baseline testing. It's a really broad topic, just say baseline testing for concussion. Now that means something different from a different clinic you go to or where you look. It's basically a very broad term to describe a bunch of different, a battery of tests that we might do to get a little bit more of a picture and idea of what your normal day-to-day life and how you experience both cognitive and physical stresses are. So the best baseline tests and the ones that show the most reliability and validity are the ones that have a ton of different measurements. If you do one thing like the SCAT test, which is a common one in sport, that just gives you a small little picture into how an athlete is feeling or how they're reporting symptoms. And I completely agree with that question. That isn't that reliable, or the validity is not that great. And I wouldn't base a baseline test just on that by any means. But if you do that in conjunction with a bunch of other things like the impact test, which is a common one, that's a little bit more intensive. That takes about 30 minutes. It's actually quite mentally hard to do for those who've done it. If you add in visual motor spatial training and reaction time and a bunch of other things that we throw into this battery of tests, then the validity and reliability of the test seems to go up a lot more. And then we have a lot more to test following the head injury. And then we have a little bit more of an idea too. So we're not just basing our results on one thing alone, which is the most inaccurate thing really is the symptoms and what you're reporting, because headache symptoms like that can vary day to day, of course.
Mm-hmm.
Yeah, just to add to that, I agree with Matthias. I mean, doing a SCAT, we did a study a couple of years ago, just looking at the variability in the SCAT of 200 healthy adolescents. And they all reported all of the symptoms. They said they have headaches, they have trouble concentrating, they, have trouble sleeping. Adolescents generally have those symptoms anyway. So it's really with the SCAT and the symptoms that are asked in that tool, they're really very general and would apply to most people on most days would tick that they have this issue. So it's not a very good baseline test. And I think the recommendation now is that those kinds of tests not be done, especially for youth, because they're not really giving you very useful information.
I would imagine another possible solution to that, like you mentioned, Matthias, is not only to increase the depth or the width of the testing that you're doing, but also to introduce kind of regular testing intervals, I would imagine. So then you get more measurements over time. You can create more of an average, create a more complete profile, perhaps, because of that day-to-day variability. But thanks very much for your responses, guys.
Yeah, that's a great point you make, Cole. Just going back to the financial aspect of it, and a lot of like having to come in, make an appointment for someone like myself, it realistically just doesn't get done. But yeah, that would be a more accurate measure.
Absolutely. So then we have a few more questions here. I'm going to try to whiz through them, but I think they're important to chat about. First thing being from Tara, who says, my husband has post concussion syndrome from football and a few accidents years ago now. Can you recommend support for us within the Fraser Valley? It seems like we're all alone and he's not getting any better. And I just wanted to address this question, not so much that you guys would know specific resources available in the Upper Fraser Valley, but to bring to light that isolation that patients can feel when their symptoms don't just go away with the initial assessments. Can either of you speak to that feeling, that isolation that we experience, or the patients can experience?
From my clinical standpoint, I think a lot of people I see come in with a head injury, whether they've had one before or haven't, with a lot of uncertainty and a lot of anxiety and a lot of questions. And so the number one thing, like I mentioned just before there, was education and having an understanding about, okay, this is what a concussion is. It's not too scary. It's this, this, and this. These are the things that are going to happen. This is how long it's going to take for most people to recover. These are the things you want to be doing. And so just giving those tools and those pieces of advice and that education piece, I think is the most important and a number one step to kind of alleviate and calm those sort of thoughts of, yeah, being isolated or feeling like you have no support. And I'll just quickly, I think there was another question there referring to like there are like physios and other clinicians do a lot of telehealth now as maybe one of the benefits of this COVID pandemic. And so we're a lot more clinicians are online. And so even if you're not in a community that has someone that has training like myself, you can access online and talk to me anywhere as long as you have an internet connection that's reliable, right? So, and like I just mentioned, education is the number one, the biggest piece in learning more and knowing more about what you should and shouldn't be doing and how to best recover. And so I don't do a lot of hands-on, like you don't necessarily need to be right in front of me physically for a lot of the benefits of what we do in like a concussion assessment. And for management too, it's much more of a verbal discussion than anything else.
Awesome. Yeah, absolutely. Telehealth, a huge resource. So thanks very much for bringing that up, Matthias. I appreciate that. Dr.
Just to add, I was just going to add that the brain injury associations have many support groups, and a lot of support groups have gone online as well. So it's easier to access them now. Yeah, so that would be one way to go.
Okay, we'll try and find those resources and provide them in the resources page following if anybody is curious. The last question, Vera, I really appreciate you sharing your story with us and asking those questions. It takes a lot of courage to talk about this in a public space. So I really appreciate it. And I want to bring the question to you guys. Vera's question is, what are your thoughts around boxing and wrestling? And I think kind of to contextualize that question, sports that are specifically targeted more at, like boxing, for example, the objective is literally to knock another person unconscious. So what are your thoughts on the kind of the long-term safety of those sports continuing to exist, particularly when we look at youth boxing, for example?
Yeah, I think that just from looking at it from the brain point of view, we can see that even a single blow to the head can cause changes to the brain. So multiple, sports where the whole point of it is directed at blows to the head is something that I think should not be encouraged, especially in the younger kids and in the youth population. Adults are in a different, it's sort of your freedom to make that choice and to put yourself in that position. But I think for the kids and the adolescents, we have a responsibility to protect them, to protect their heads and their brains from that. So I think this is really critical that the research gets out on understanding that the long-term effects on boxing or the other kinds of sports where you are intentionally trying to damage the head is going to cause long-term damage to the brain. And I think it's our responsibility to make sure people understand that.
I'll maybe just quickly add, it's a really tough topic. And when it comes to sport, I kind of contextualize it myself in terms of like sport and health. I see a lot of athletes in the clinic, and I'm an athlete myself. And I recognize, and I think a lot of people intuitively do, that if they choose a sport, and so maybe I won't talk about as much youth, but just like if you're an adult and you can make your own decisions on what you want to do, if you choose a sport that's high risk, we probably know it, right? I like to downhill ski. I know I could fall and I could have a concussion, a more serious injury or trauma. So I have to weigh the balance of whether or not I would like to continue to do that high risk activity for the benefits that are sometimes not. If people don't do that sport, they don't actually necessarily realize the benefits that they might bring that person, like fulfillment in life, right? An outlet for stress, a lot of the other benefits that you can get from exercise. Maybe it is literally something you identify with as a sport, like wrestling. I've worked with wrestlers and they identify as a wrestler. And if you took it away from them, that would be like taking away part of their identity. So I think it's careful to be careful there when you kind of look at these things, these topics, because even from younger ages, some athletes, they just really want to do it. And so it's just something to think about and for the conversation to continue on this.
Absolutely. It's a critical point, I think, for all healthcare, but particularly in this conversation, we never want to stray into overly paternalistic impulses. And I really appreciate you bringing that up. So thank you. Vera, the only other thing I wanted to add to that is that I appreciate your question. If you'd like any support, any further support, please don't hesitate to reach out to any of us at the Learning Circle, and we'd be happy to connect you further with other resources. I imagine we'll be able to get a copy of both presentations, but I'll have to confirm that later on. The last question, I swear, Doctor, I wonder if you've been able to associate various MTBI brain injury biomarkers to functional impairments. From a question from Deborah.
Sorry, I'm just looking at the question. So she's saying symptoms and balance. So because I'm sort of taking this network approach, I'm not able to relate specific kind of areas of damage to the functional impairments, if I understand what she's asking. So I'm looking at it more globally as to how the network changes and the impacts on all sorts of function, because it's very rare to have changes only in one particular system, like in balance or in cognition. It usually affects multiple kind of systems, rather, I should say.
Awesome. Okay. So we've gone 5 minutes over time. I really appreciate your guys' morning. Thank you so much for donating your time and your knowledge and your experience to come and share with us today. And thanks to all the participants that were able to stay right to the end. I know that we went over time there, so I appreciate it. Quick plug for the Learning Circle. We've got a bunch of events coming up. Elder Series is coming up next week with Roberta Price. We'll also have Priscilla Setti come and join us and talk a little bit about climate change and its impacts on Northern Indigenous trappers. And then into December, we're going to welcome the Doula Collective to talk to us about how traditional birthing practices and their work has been impacted by the pandemic. So very excited about those upcoming sessions. Please check out our website for more information. And with that, I'm going to sign off. Thanks very much, everyone.
Thank you. Thank you very much.